There's so much information out there, and it's really hard to know what is actual real information. So providing you guys with speakers who have the knowledge and the background to give you guys some information. So tonight we have Jesse Duppler coming out of Prescott, Arizona tonight. She's going to talk about common pains and different things that we have riding the bike, which I'm sure everybody probably have something going on, and then how to fix it and different things that you can do. So Jesse, go ahead and take it away.
All right. Well, thanks for having me, Lacey. I know Britta, and Britta knows that I will talk about bikes and PT for as long as humanly possible. So I'm psyched to be able to do that. I promise I'll get you guys out by about midnight or so, and then we'll be good to go. So let me pull up. This is first. Oh, there we go. Okay. Britta, another one just popped up. Oh, that's you doing that. Okay. This is my first time using Google Meets too, so we get to learn how to do that together. So let me share. All right, just double checking. Do we have the right screen up there, Lacey?
We do.
Rad. Okay. All right. So we're going to talk about some different bike stuff, cycling pain, bike fit fixes, some mobility and strength so that you can feel better on the bike. So real quick, a little bit about me. I'm a lifelong competitive cyclist. I used to live out in New England where cyclocross is a big thing. I don't know. Do you guys have cyclocross in Idaho? Because we don't have it in Arizona. Is that a thing? Nah. Okay. So yeah, it's more of a New England thing, but I raced cyclocross and road out there. Before going to PT school, I was a bike fitter, and that's actually part of the reason that led me to PT school, because I saw a lot of people with bike fit issues, and I saw that there was things going on in their body that also needed changing that I, as a bike fitter, could change. So moved out to Arizona in 2016 for PT school and realized that the West is where it's at and have stayed ever since. So I own Chain Reaction PT here in Prescott. I work mostly with cyclists, ultra runners, and then some hikers as well. So this is me. My husband and I met on bikes. We love riding bikes. This is me racing from a long time ago. So just bikes have really brought me from racing to my profession to being able to work with cyclists. So pretty big fan. And I really like being able to ride in cactus and sunshine instead of mud and snow. So I heard you guys got snow today, so thoughts and prayers there. But I know you guys need it, so that's good. All right, so why bike fit matters. You guys know some of this stuff. So we have bikes and we get them kind of stock off the floor, right? It's small, medium, large, extra large. And all of our bodies are really different. So even though we have kind of stock bikes, we know there's a lot of things that our bodies need in order to make that bike fit us better. So obviously one of the big ones is comfort. The more comfortable you're on the bike, the better you're going to feel, and the more power you're going to be able to put out too, because you're going to be in a more advantaged position. So power, endurance, and straight up happiness, right? Like you feel better when you don't feel like crap on the bike. So when it comes to feeling good on the bike, there's always two variables. So it's how the bike supports the body. So how the bike is fit for your body, but also how the body generates force on the bike. So that's when we start to talk about how both bike fit and PT are really important and are a really good thing to meld together, because we need both those things. Because if we have something, I see someone on the bike, let's say I see someone on the bike with knee pain and we have to change saddle and maybe fore aft, but they also don't have hip strength that's strong enough to support the knee. No matter what we do on the bike, we can support them, but we're still going to have stuff we have to clean up at the hip or at whatever strength we might need to. So what we're going to do is we're going to talk about some of my common pain points. So I do have time for questions at the end. So, and I love answering questions. So if you have anything, make a note. If it's really dire, raise your hand, we can answer it during. But we're going to talk about first some of the common places I see, most often pain I see. We're going to talk and then dive into specifically into some certain points like knee, back, low back, neck. I have hip up on here. So a couple of things I see are knee pain, hip pain, both low back and neck pain, and then a lot of numbness, tingling in the hands and numbness, tingling in the feet. As I go through all these, I'm not going to specifically hit on hip pain because hip is usually a symptom of what's going on in other places. So when we address people's knee pain on the bike or their back pain on the bike, those variables we change that we address are the same things we were to change for any sort of hip pain. So it'd be really redundant if I just went over a bunch of hip pain things too. So, but if you feel like we need to dive in a little bit more into that at the end, we can totally do that. So starting off, we're going to break it down. We're going to talk about the pain point. So where on a body it hurts, what we're going to change on the bike for it to fix or to feel better, and then what we're going to change in the body to help support that. All right, so let's talk about one of the things I see a lot of, which is knee pain in the front of the knee. So most often, and we're going to talk a little bit kind of in broad strokes, because right, when we talk about how everyone's different, there's a lot of things that can contribute to pain anywhere. But so I'm going to talk about and synthesize kind of the things I see in general and how we can best start to give you some tools to fit yourself on the bike. So when it comes to knee pain on the front of the bike, big thing is your saddle is too low. When your saddle is too low, what that does is it puts your quad, the muscle in the front of the thigh, at a disadvantaged position. That creates more tension through both the patellar ligament and the quad tendon, which then pulls on that knee and a lot of time causes that pain on top of the knee. Oftentimes it's either on the top of that kneecap or on the bottom. Either one will get that because the quad tendon's at the top that connects to the patella, the kneecap, and then the patellar ligament is below that. And both those things will get pulled on when the quad is not in the advantage position. So what are we going to do about that? Oh, and also, if you're like me, I've got the memory of a goldfish, which means I got a 5-second memory. So if I go to a presentation, I don't remember a whole lot of it. So throughout this, I've actually sprinkled some QR codes. I don't know if your screen's big enough to see it or not, but this QR code is for a bike checklist that I have. It goes through the 5 big things you need to look for on a bike. We're going to talk about them today, but if you want them at the comfort of your own iPhone too, just go ahead and check out that QR code and it'll pull it up for you. You just have to enter your email and then you can have it too. So when we talk about bike fit, when we talk about where the saddle should be, as far as what the height should be, we take the angle from the knee. So we look at the middle of the knee and then bisect the femur and the lower leg. And that's the angle we're looking at. We want that knee angle at the bottom of the pedal stroke to be somewhere around 145 to 155 degrees. Again, if it's lower than that, then we have the propensity to start to put more pressure through that knee, through that patella, and typically have some of that knee pain. So, hey, one of my pictures didn't show up. Okay. So as far as body fix goes, an easy one is some quad foam rolling or mobility. When, as cyclists, we use our quads a lot anyways, right? So they tend to be something that does get a little hypertonic or shortened. So just an easy fix is doing some quad foam rolling. The other thing we have to work on is hip stability. And as we go through these, you'll notice there's a bit of a theme. Hip stability is one of them. What I tell people is the knee is the victim of the hip and the foot. And our foot is cemented onto the pedal. And so we can only do so much with that. We need the hip to be able to drive power down into the knee appropriately. If we don't have the ability at the hip to do that, what happens is the knee ends up getting more force through it, and then we start getting some pain too. So like I said, you'll see a lot of me talking a lot about hip stability. And as we get to the PT part of that, I'm going to dive into exactly what that looks like and what that means. But just know that, like I said, a little bit of a theme today. So then knee pain in the back of the knee. So a lot of times saddle's too high when we have knee pain in the back of the knee. Why that is because it overextends the knee at the bottom of that pedal stroke. That, again, puts the hamstring at a disadvantaged position, which then requires it to stretch even further. When we have to stretch the hamstring past where it likes to be for it to be able to actually generate force through that pedal stroke, it not only irritates the hamstring, but it also irritates the sciatic nerve that runs down the leg. So a lot of time that pain in the back of the knee, it can either be hamstring, calf, or a lot of times it's the sciatic nerve being on too much tension with revolution after revolution after revolution. So then again, we talk about what knee angle do we want to have it be. We want that 145 to 155. And as far as a body fix goes, we want pelvic mobility. The sciatic nerve goes from our back all the way to the bottom of our foot. And so if the pelvis isn't mobile, it oftentimes will get entrapped there. I hate to tell you guys, I forgot some of my models in my clinic today, but I got a couple of them. One of them is the pelvis. And so when we ride, the pelvis has to do this motion back and forth. If we have this pelvis that can't move as much, the sciatic nerve that runs right through here cannot actually move like it needs to and gets entrapped here. So that's why some pelvic mobility stuff can be really important. I have some pictures on all of these different exercises. I have another QR code that takes you to my YouTube as well that has all these exercises on it. So I know the still pictures don't really do it quite as much as justice as you'd like for being able to see what we're actually doing. So that QR code will come up eventually for you to check out exactly what we're looking at. So same thing, right? Hip stability. Hip stability is incredibly important when it comes to protecting the knee. And then we've got sciatic nerve mobility too with a sciatic nerve glide, which is what I'm doing at the bottom of that slide there. So then knee pain on the outside of the knee. This is a pretty common one. And I don't know if a lot of you are also runners too, but a lot of times when people have pain on the outside knee when they're running, they talk about IT band syndrome. That can be one of the things that can get irritated when we have cleat placement in the wrong spot. but it's kind of just one of the factors. So a lot of times if we're seeing knee pain on the outside of the knee, we have to look at where the cleat is actually positioned. If the cleat is positioned too far out, it'll actually push your foot in. And what that's going to do, because again, we have only a pelvis on a saddle and a foot on the pedal, we don't have the ability to really change those positions. It's going to put some torque through the knee itself. Typically, that'll put extra torque through the ligaments on the outside of the knee and then cause those lateral forces and pain to the outside of the knee. So real general rule of thumb is just start with the cleat in a relatively centered position. So again, we can work on some of the tissue that does get stretched. One of those is the TFL. The TFL is the muscle that connects to the IT band. The TFL stands for tensor fasciae lata. It's a Latin term. But the IT band itself is connective tissue. It's non-contractile. The muscle at the top of the IT band is the TFL, and that's the thing that if we foam roll that can help decrease some of the tension in the TFL. Foam rolling your entire IT band really isn't going to do it. We need something like 1,000 PSI to actually deform connective tissue. So focusing just, and I'll show you guys in a little bit here what that muscle looks like. Focusing just there can be really helpful. And look at that again, hip stability. When we talk about some exercises, you guys are going to, again, hear a lot about hip stability. When we look at this picture, we see that this kind of doesn't really look totally in the necessarily middle of the foot. But what we have to remember, no, this picture didn't show up. Well, in this picture, I've got a foot superimposed on the, that's weird, on the cleat to show that because our foot is not a perfect box, we have to make sure we're taking into account the fact that we want this cleat to line up somewhere between the second and third toe. So just know that when you're putting a cleat on, a lot of times the center may or may not be just right in the middle center of that actual cleat itself. You want to make sure you're trying to line it up with where your actual toes land, because we have a foot that creates kind of an arc, and then our fifth pinky is usually all the way over here. Well, bummer. Oh, there it is. Nice. All right, we do have it. So that's what I was trying to get at. So making sure we try and get somewhere between that second and third toe as far as the middle of that cleat. That's where we want it. All right, you and I are going to both figure out like which pictures do show up and what pictures don't. So last one for the knee pain on the inside of the knee, right? So again, there's either one extreme or the other extreme. So when it comes to knee pain on the inside of the knee, a lot of times we see that cleat placement, which is too far in. So same thing, just in reverse what we just talked about, right? Cleats are too far in, they'll push your foot out, causing excessive force through the inside of the knee. This is a lot of times too, where more so than the outside, if we're having inside knee pain because of cleat position, it'll put pressure through the meniscus too, the kind of pad that's in the knee. So especially if you're having a lot of pain after you get off the bike too, we know we want to look at that cleat position to make sure we're not putting too much force through both the ligaments and the structures there, but also the meniscus itself. Oh yeah, so I've got a couple of videos. So this is oh boy. Well, I thought this was going to stop, but this is Laura, who I just did a bike fit with not recently. And this is a really good example of both cleat positioning and where we have to factor the body in. So if you can see, if we look at Laura's right knee, as she comes up and around the pedal stroke, you'll see it dives in every time it gets over towards that top tube. Now, part of that is because her cleats were positioned incorrectly and we needed to move them in. But part of that is because she tore her ACL on her right side. So as we were doing our bike fit, we not only, I'm going to pause that, not only had to change her cleat positioning, but we also had to give her some stuff for her hip to make sure, again, it's actually supporting her knee. Because with an ACL injury, we know the knee has structural changes and we need to make sure we're supporting it with the joints above and below. Okay, so going back to some fixes with that real quick, starting with the cleat again in a relatively centered position. One of the other muscles that we have to attend to or pay attention to is the adductors. Those are the muscles on the inside of the thigh. They're kind of the forgotten muscle group. We don't really exercise them that much unless we're being very intentional about it, but they can get very tight and they connect right over the knee. So you can foam roll those guys. If they're tight, you'll know it because the foam rolling feels pretty intense sometimes. Okay, so like I've said, when we talk about knee pain, the knee is the victim of the hip and the foot. If we do not have stability in those two places, the thing in the middle is going to be a victim of that. So again, that's why I'm harping so much on what's going on at the hip. And we're going to talk mostly in terms of the hip and less at the foot, because we don't have a whole lot of room with changing the foot and the pedal complex on how they interact with each other. If we have a flat pedal, obviously we have the ability to move the foot more. If we're clipped in, then we are really at the mercy of how we position that cleat for the most part. All right, so now we're gonna talk about some neck pain. So Laura also came in with a decent amount of neck pain. And one of the things we wanna look at when we talk about neck pain is, let's see if I can zoom in. Yeah. Basically, right where the head kind of meets the spine or meets the neck, we can see that basically Laura's head right now is pretty much straight up and down and then immediately just goes into her spine where it starts to round. That is a pretty common positioning that will cause a decent amount of neck pain. You'll notice she has to tip her chin pretty far up to be able to look down the road or the trail. That's going to put a bunch of pressure through back of the neck and typically cause not only neck pain, but a lot of times numbness and tingling in the hands too. The nerves that cause numbness and tingling in the hands, they originate from our neck. So if we have issues or if we have positions that are going to put the neck in disadvantaged positions, it's also going to impinge upon these nerves that is then going to cause numbness and tingling in the hands. So a lot of times those things are concurrent. You guys might experience that too. So there's a couple things that can really start to affect some neck pain. One of them is if your saddle is tipped too far down. If your saddle is tipped too far down, what it's going to do is it's going to move your center of mass forward, and it's going to require you, in order to, again, look down the trail, look up even more. Similarly, if your saddle is too high, it's going to do the exact same thing. It's going to push you forward, and then you have to really crane your neck, or if your reach is too low, so if your bars are too low. Now, the thing about reach is that it kind of works within a window. If your reach is too low, so if your bars are too low, creating a longer reach, which is this positioning right here, it's going to stretch you out, which is then going to require that same neck positioning. If we put your reach too close, what happens is we bring you on top of the bike, and then in order to actually not just pitch yourself forward and go over the bars, you have to sit yourself up in this position. So it's a kind of a Goldilocks situation that we really have to make sure that we're finding you right within the right parameters, and we'll talk about what that looks like in a little bit here. That's what I just said. So then if we look at before and after, I really thought these were going to pause. If we look at kind of Laura's chin positioning, so this is before, this is after. This is your poor man's fix as to how you raise bars. If you don't have a different stem, you just put a couple towels underneath. So what we're looking at is a couple things. We're seeing that Laura doesn't actually have to tip her chin up. She can actually just keep her chin relaxed. And if we're looking at her mid back here, we no longer have this arch. We now have a little bit more flat back as she looks down the trail. That's going to take pressure off the neck and allow her to actually not feel like she's constantly craning her neck. Okay, so when it comes to what we want to look at for treating neck pain, we want to make sure, again, looking at knee angle first, because if we have a saddle that's in the wrong position over the center of mass, it's going to change everything else. Bike fit's basically a bunch of geometry, which I wish I had paid better attention to in high school, but I figured it out along the way, because if we change one part of a triangle, the other parts change as well. So that's why a lot of times we start with what's going on at the knee and at the saddle height, and then work our way out from there. The other big one, again, is assess reach. When it comes to body fix, things we want to work on is making sure thoracic, so mid-back mobility is good. Serratus anterior, that is a muscle that comes all the way from your shoulder blade and wraps all the way around your rib cage. It's the muscle that when a boxer punches, and that feathery muscle you see, that's the serratus anterior. That muscle is important because it is the thing that holds us here on the bike instead of letting us sag in between our shoulder blades on the bike. And I'm sure when you've gotten tired, all of us have felt that when we just kind of hang out in this position instead of actually being strong and having our chest up on the bike. And then scapular strengthening. So your scapula is your shoulder blade. All of the muscles in the back of the shoulder blade connect to the shoulder blade are really important when it comes to supporting the neck and the spine, both on and off the bike. So that's what I just talked about. So this top one's me doing some thoracic mobility, and then this bottom one is doing some serratus work too. All right, so we're going to go into hand numbness now, because like I said, neck and hand numbness typically go, or neck pain and hand numbness typically go hand in hand. So that means that some of the culprits for hand numbness are the same things that exacerbate or bother neck too. So again, if saddle's tipped too far down, it's going to shove your weight forward, which is going to put more pressure through your hand and cause more of that numbness and tingling. Your levers, if your levers are positioned too far in, if you're on drop bars, that will also put a bunch of stress through the tops of your hands and through your wrists. One of our nerves runs right along here and innervates the fingers. If we are constantly reaching for the levers in this position, that radial nerve is constantly on stretch, which will then cause some numbness and tingling into some of these fingers as well. With flat bars, if your levers are too far down, same thing. It's going to push a bunch of weight into those hands. And if they're too far up, it's going to kink right through here, which is right where that median nerve is. Median nerve is the one that people get kinked a lot for carpal tunnel. It's also the one that'll cause numbness and tingling, especially if you have it in your thumb and your forefinger. That's typically median nerve. And then again, bars too low, we're pushing ourselves forward. We're putting too much pressure on both the hands and on the neck. And we've got both nerves and arteries that aren't going to be able to tolerate that kind of pressure for long periods of time. All right, so again, we've got this QR code if you guys want it. And then typically we start with more of a level saddle if we feel like saddle is one of the big things that's contributing to some of this pain. Making sure we have an appropriate reach and an appropriate stack. So the reach is this angle right here. And we are going to go step by step on all of these in a second here. But for a mountain bike, we want this angle to be somewhere around 80 degrees or so. So how many mountain bikers we got in here? Show of hands. Awesome. How about road? All right. Couple less. And then gravel? All right. Okay. Some gravel riding out there, huh? All right, so we're going to talk about becomes a little bit different on the top half between mountain bike and then gravel and road. And we're going to talk about what both those things look like in a second here. But for mountain bike, we want this shoulder angle, so bisecting right in the middle of the shoulder through the trunk and through the upper arm to be somewhere around 80 degrees or so. For body fixes, again, we're talking about, thoracic mobility, serratus anterior strengthening. So same things that we talk about for neck pain, and then nerve glides too. So our nerves that run from our neck all the way down to our hands, they pass through our muscles and ligaments and a bunch of stuff along the way. If they're getting crunched in some position, a lot of times what happens is they get inflamed and they get sticky. Nerves, unlike muscles, do not like to get stretched. So what we do want to do when we have some sort of nerve involvement is teach them how to glide back and forth where they're supposed to go from the neck to the hand. So that looks like, honestly, they're kind of funny. It looks like putting your hands in funny positions and working on getting some of these different nerves to be able to actually glide through your neck, through your hand, or excuse me, through your arm, through your hand, and decrease some of that numbness and tingling. I think I got a picture of that guy next. Yeah, these are some of the nerve glides. Like I said, they look kind of funny, but they work really well. So, like I said, I got a video on that too later here. So foot numbness. Anyone? Maybe I should have been asking what you guys have, but anyone get foot numbness on the bike? Yeah, so that's a big one. I see that a lot, especially on longer gravel rides too. A lot of times where that comes from is if our cleat is too far forward. The more forward your cleat is on your shoe, the longer lever arm your foot has to actually push down on that cleat. So when we have a longer lever arm, as we push down through our pedal stroke, it ends up putting a lot more pressure through the toes and then requires, again, both the muscles and the nerves to have to work in a really extended position. That sciatic nerve I mentioned, like I said, it goes all the way down to the very bottom of our toes. That means, again, if your saddle is too high, like we talked about earlier, that will also stretch sciatic nerve and will also cause numbness and tingling down into the toes too. So when it comes to that foot numbness, for general rule of thumb, we talked about cleats being in the middle of the shoe. As far as for aft, we want it somewhere around at the right behind the first metatarsal. So right at the base of your big toe, basically, right behind that. Again, we want appropriate saddle length and that saddle height. And then for body fixes, low back stability becomes important because that's how we support the sciatic nerve from where it starts up at the back. Sciatic nerve glides for where peripherally goes through the nerve, and then foot strength itself too. Okay, so we're going to go to bike parameters. Like I said, this is just a QR code for those 5, so you can have them to review at your own and actually apply to your bike fit, but we're going to talk about them right now too. So like I said, saddle height, we've been kind of talking a lot about this, but now we're going to talk about this in the terms of the variable we need to look at and what you'll see on the bike if it's not within those parameters. So saddle height, 145 to 155. If you have your hips that are rocking a lot on the bike when you're riding, or if you're pointing too much with toe down, that's a good indication to decrease your saddle height. If you have pain in the front of the knee, it's a good indication to increase that saddle height. Another small note here, if your hips are rocking a lot too, the other thing you want to look at is saddle size too. If you're on a saddle that's too wide, you're going to have to rock your hips to get to either side of it over and over again. Okay, knee over pedal is the second thing we want to look at. So when we have our knee at, our foot at a 3 or 6 o'clock position on the bike, if we drop a vertical line down from our tibial tuberosity, your tibial tuberosity is that bumpy part on your shin right underneath your kneecap. We don't measure from the kneecap itself because A, everyone's got a different width kneecap, and so it can actually skew measurements. And B, your tibial tuberosity actually gives us a better idea on where your quad and your muscles in the front of your shin are actually working to push down into the pedal. So if we drop that line down, that line should bisect your pedal spindle, relatively speaking. There will be differences fore and aft from that, but if we're starting out trying to find parameters that make you feel good on your bike, we start there and then we work forward and back from there. So if your knee is ahead of the pedal spindle, you move your saddle back, or you move your cleats forward. And that depends a little bit on what we see kind of overall on the bike, where we want to start with that. Third one we want to pay attention to, ankling. So that's how much toe down we have as we go through the pedal stroke and at the bottom of that pedal stroke. At the bottom of the pedal stroke, a lot of times we'll see again that toe down positioning. We want that angle to be no more than 10 to 20 degrees. So if we have more than 20 degrees, a couple things we can do: lower the saddle or move those cleats backwards so we decrease that lever arm. All right, I mentioned shoulder angle before, somewhere between 70 and 90, so right in the middle, 80 degrees. This is for mountain bikes. Again, the handling is different between mountain bikes, road bikes, and gravel bikes, and so we're gonna have a little bit different up top geometry that we wanna focus on. If your angle is more than 90 degrees, so if you have a bigger reach, some things we can do are either move the saddle forward to decrease that reach, or we can increase our stack height to bring the bars up. Both those things will help decrease some of that reach if it is, or the shoulder angle if it is too far. Now, as we change some of these things, we have to make sure we're taking into account all the other things we just talked about. If I push my saddle position forward, that's going to change those two angles we just talked about with knee over pedal and knee angle for extension. So when I'm doing a bike fit, we're only ever changing one variable at a time because every other variable affects all the other variables. So we change one thing, we look at what that looks like on the bike. We change one thing, we look at what that looks like on the bike. I always tell people bike fits are a game of millimeters. Just small little changes actually make a pretty significant difference. Last one here, hip angle, which is directly related to that stack height. So where your bars are. Your hip angle should be somewhere around 50 to 55 degrees on a mountain bike. That's measured from basically your greater trochanter, which is like that bumpy part on the side of your hip, bisecting your trunk, and then dropping another line parallel to the ground. If we have a really acute angle, so less than 55 degrees, another thing we want to look at is either increasing our stack height. So again, coming up here, so we're not at such an extreme angle here, decreasing stem length to bring you closer, or decreasing the sweep back on the bars. If more than 50 degrees, again, we can either move the saddle back or we can drop or increase that stem length as well. Real quick, so we're going to talk about what the differences are there. So on a gravel or a road bike, we are a little bit more stretched out. We don't have to worry quite so much about handling on trails, and we just have typically top tubes that are a little bit longer. So for the shoulder angle on road and gravel, we want somewhere around 100 degrees. All these parameters stay the same, so all the same stuff is the same. And then stack height and hip angle, same thing. We're going to have a little bit more of an acute angle because we have a little bit longer reach. So again, I have all these parameters for both mountain bike and mountain bike for you available, so you don't have to remember all these differences. Okay, now we're going to start to talk about the part where the body fits into this. So when it comes to bike fits, the number one thing I typically have to get people to do is to bring that stack height up. A lot of times people think like being aero is the most important thing and what's going to impact you the most. It's not. Being aero is only as good as how your body can actually create force in that position. One of the big things that happens when we get really aero is actually it's about 2 or 3 things. First thing it does is the more tipped we are here, so the further down we are, the less room we have. I don't have enough room for you guys to see this. The less room we have for this knee and this hip to be able to come up over the pedal stroke. That crunches down on the hip, and a lot of times will either cause pitchiness in the hip, or it'll cause people to swing their knee out to try and clear their hip. That's going to cause knee pain, and it's also going to make you bleed a bunch of power on the bike too. The other thing this does is the more we come forward, the less ability we have to expand the rib cage. We're now cramping down on that rib cage. Your rib cage needs to be able to move in order for us to breathe. Breathing, turns out, is pretty important on the bike. And so breathing is how, obviously, we oxygenate and clear CO2. That's how we measure our VO2 max, all these sorts of things. So if we don't have the ability to use our rib cage and our diaphragm to the best of the ability, it doesn't matter how aero it is, you're robbing Peter to pay Paul. So I always liken it to if you have a car that's super aero and super fast, but if your car doesn't have any gas in it, doesn't matter how fast it is. So that's why when we talk about bike fits, it becomes really important to make sure we have some parameters to go back to, so we know that we're creating a bike fit that's actually going to give people power and comfort on the bike, and not just make them feel like they're super, super fast. That's typically kind of a hard one to get people to break up with, but once we put them in a better position, they go, oh my God, like I feel so much better. I felt so much faster. They tend to come around to the light side after that. So like I mentioned, feeling good on the bike consists of two different variables: how the bike supports the body, we just talked a bunch about that, and how the body generates force on and off the bike. I actually have less info on some of the exercises and stuff, so I want to field some more questions from you guys about PT, because it depends kind of on every crowd I talk to about what questions they have for exercises. So I don't have as much info on this, and I'd love to just throw it to you guys if you have some specific questions about it, but we're going to dive into what I do have. So when it comes to figuring out, okay, how are we going to get someone's bike to really be as efficient as possible on the bike? I basically have 4 phases that I take people through when it comes to our physical therapy. The first phase is stability. And again, you've heard me talk about this a little bit, but if we don't have stability at the hip, specifically at the hip and at the low back, it's like trying to shoot a cannonball out of a canoe if we're trying to generate force with the pedals. It makes it really hard. So one of the first things we have to do is address any sort of stability or stabilizing muscles and make sure they're strong and they know how to work for you on the bike. Then we need to coordinate those muscles with all the other bigger muscles on the bike. You guys are cyclists. You're strong. Your glutes, your hamstrings, your quads, they all know how to do their stuff all day. The stuff underneath those muscles are the things that need to learn how to coordinate with those big muscles. Then we have to strengthen into those patterns so that muscles actually know how to basically share the load with everyone and be able to have that muscle memory to do that for 1, 2, 3 hours on the bike. Last stage is performance. So making sure that they can do it at a fast ability. So with power, can do it for long periods of time and can do it at race pace. So that's the progression I take all my athletes through when we're looking at either just how they can get better on the bike, or if they do have some sort of pain point they're coming in to talk to me about as well. All right, so there's a couple different stabilizers that we're going to home in on for a second here. Stability comes mostly from these 2 groups of muscles. At the spine, we have a group of muscles called our multifidi. They go all the way from our neck all the way down to our pelvis, and they connect to every single vertebrae along the way. They're the muscles that we need to fire quickly and strongly whenever we move a limb. Otherwise, we get that cannonball in a canoe syndrome, basically. With those multifidi, we need these small hip stabilizers to also fire as well. Show of hands, who's been to PT? Holy crap. Okay. Oh, we're just taking a second. Okay. I thought you were going to say no, and I was going to be really, really impressed with you guys. Sometimes when it comes to PT, a lot of times people think, oh, I just need stronger glutes. For cyclists specifically, y'all got good glutes. What you need is stronger stability and stabilizing strength underneath those glutes. That's what these muscles are. These are piriformis, gemelli, obturator and turnus, some of the other muscles that also contribute to stabilizing the hip itself. All right, so when it comes to stability, we have stability up and down the chain. There's a couple muscles that are really important, or a couple exercises are really important in getting some of those muscles. There's an exercise called hip hikes. That's what we use for our multifidi. And again, this QR code will get you to all these exercises. I'm sure when you guys went to PT, a lot of times you get clamshells prescribed. There's a really specific way to do clamshells that allows you to use those muscles I just pointed out underneath, as opposed to just using your glutes over and over again. Supine march, that's a muscle to get an exercise to get core muscles going. And then chin tucks are an exercise for addressing neck pain as well. And then the other big thing is mobility, right? So when we're riding, we're stuck on the bike in one position, relatively one position for long periods of time. For most of us and for most of us cyclists, what that ends up doing is it ends up giving us a pretty stiff mid-back here and a difficult time actually getting out of essentially this position, everyone's favorite slouch position. So a lot of the mobility I give my cyclists really focuses on opening up thoracic rotation and thoracic extension. This feeds into what we just talked about earlier about really needing a rib cage that can expand and contract too. Your thoracic spine connects to your rib cage. And so if your spine is stiff here, it also doesn't allow your ribs to move as well as they need to. So I'm connected to everyone. You guys may have kind of figured that out from what I've been talking about. And that's probably one of the reasons why, and definitely one of the reasons why my practice is called chain reaction. All right, so this is basically what it comes down to, right? So we need comfort plus good force generation in order for ourselves to get that performance we want. The comfort comes from both the bike being able to fit you and for being able to generate that force on and off the bike. So that's how we really have to marry all these parts together between the bike fit, the PT, the strengthening to make sure that we've got a really good amalgam of exercises and recommendations for a bike fit to make sure you do feel good on the bike over and over and over for days on end with whatever you might be doing, whether it's a long gravel race, bike packing, mountain biking, whatever it might be. All right, so that's really all I got for you guys. You can find me on a bunch of different places. I post a lot of stuff on Instagram. If you are interested in more information about bike fits, PT, exercises, I post weekly 20-minute workouts because I'm a huge proponent of my cyclists doing strength training as well. So that's a good place to find me. YouTube, I've got a bunch of exercises, and then my website's chainreaction.com. And like I said, I like to provide a lot of handouts or info for you guys because I can't remember a dang thing if I don't have it in front of me. So I just want to make sure I gave you guys some good resources for that too. What questions can I answer? What do you guys got? Nothing? Unless I'm not seeing anyone.
Pain
okay, shout
out. Achilles. Do you see anything with fit causing Achilles issues?
Yes. Is this a personal question?
Yes.
When do you get Achilles pain? Is it like at the beginning of the ride, end of ride?
I got it somewhere around mile 200.
Of how many?
400.
Okay. Was this a one-day event or what did it look like?
Several days.
Okay, phew. And is this like, has it stick around from then, or has it kind of just gone away after that?
It hung around maybe a week after, and it's gotten better pretty quickly after that. There's kind of a burning sensation through the Achilles.
Mm-hmm. Yeah, that is typically two different things. So when it comes to bike fit, it can be just the bike fit itself. You clipped in or you flats?
What?
Sorry?
Clipped in.
Clipped in. I was going to say 400 miles on flats would have been pretty miserable. So when it comes to being clipped on the bike for that long period of time, like I mentioned, we're stuck in that position, right? The foot itself, in order for it to shock absorb over time is, if I have a foot, it needs to be able to, if this is the arch, both squish and then come back or supinate. When we're stuck in a bike shoe for long periods of time, it loses the ability to do the squishy part of it. If we don't have that shock absorption at the foot, what happens is the Achilles is the next tendon that will provide some shock absorption. So when it comes to just like that kind of volume, you've got a good system, but sometimes it starts to break down over time. Also, if you do happen to have a saddle that is too low, it puts you into a little bit more dorsiflexion, so ankle up position, which will also then put extra stress to that Achilles. So it could have been two of those things. Third thing could be, was there a lot of climbing on it?
Yeah.
Ugh, good on you. So with a lot of climbing too, were you doing seated climbing or standing climbing?
I do a fair amount of standing and seated on that distance.
On that distance, yeah, okay. So just in general, like having that much climbing to be both in and out of the saddle, it just requires the calf to work a lot harder too. So the things I would check as far as bike fit goes is saddle position with what we talked, saddle height with what we talked about here. Cleat positioning, if it's too far forward, it can also create some of that toe down. I have some bothersome there. And then also ankle mobility too. So I'm gonna move this around a little bit because this is a good, little test for everyone. So we need what is called dorsiflexion, this movement right here, in order for us to be able to pedal around the bike. So if you kneel and you can't get your knee very far forward of your foot without your heel coming up, we know you have some calf restrictions here. And so one easy thing to do, honestly, is just some straight up calf lengthening. So some calf mobility work, stretching, foam rolling, whatever, but also looking at that bike position and making sure it's not putting you in too much of a flex position there. So it's kind of a quick and dirty tip to look at to see kind of where your foot is at or where your ankle mobility is at and how you might need to change your bike positioning to fix it. Does that make sense?
Yeah.
Where was that ride?
Just Stagecoach 400 bike packing.
Oh, yeah. Cool. All right. Good on you.
Thanks.
What else you guys got? Nada? What you got?
You talked a little bit about posture and like your core strength and pelvic tilt on the bike. Those things play into one another. And, yeah.
Yeah. So let's see. I'm bringing my pelvis back out. Actually, I'm bringing two things back out. Give me 1 second, guys. I'm going to pull something up if I can figure out how to do it. I'm a big visual aid gal. And like I said, I forgot a couple of my models I wanted to bring. Let me see if I can. Okay. Y'all see a body on the screen?
Yep.
Yeah.
Rad. Okay. So when we talk about, and then can you guys still see me or just the body on the screen?
Yeah.
Both? Cool. All right. So when we talk about saddle position or pelvis position on the bike, we're looking to have a relatively neutral saddle. Oh, sun's coming in just at the wrong spot here. You guys might not be able to see that very well. Okay, I'm doing a fake saddle. So when we're talking about saddle position on the bike, we need a pelvis that is fairly level. When we have a saddle that's tipped too far down, a lot of times it tilts the pelvis. And if we have a saddle that's tilted too far up, it actually scoots the pelvis. When it comes to how the pelvis is going to support you on the bike and how that's going to relate to the abdominal muscles, we need the abdominal muscles to be strong enough to keep you here without letting you start to just arch your back here. A lot of times when people don't have the abdominal strength or the core strength to keep themselves in this position, they start to let their tail come out here and then just sag through here. And the funny thing is we let tail come out here, but we still manage to be able to also sag through our mid back too. So we end up accentuating a curve that is not super helpful for us. Why the core, why the abdominals are the thing that's important to actually support the pelvis is because whoopsies, as I throw my pelvis, the abdominal muscles, specifically the obliques, connect. This is your internal oblique. It connects down onto the hips and all the way around into the back. And then your external obliques do the same thing and cover even more surface area. So if you can imagine these muscles right here, when they are strong, they're the things that connect to the pelvis itself and actually help keep us stable in the saddle. So if we don't have abdominal tone or abdominal strength here, oftentimes we have a pelvis that doesn't really know how to sit on the saddle. And that's why we also have to look at saddle positioning too, because a lot of times that tilt will cause it too. I think I went into a little bit of tangent there. Did that answer your question? Ooh, is that what I wanted to do?
Oh. And maybe can I do a follow-up?
Yeah.
Can you talk about how that plays in with back pain, lower back pain?
Yeah. So when it comes to, I'm bringing my guy back up. Okay. So I said the word core. When we talk about core, we're not just talking about the abdominals. Your abdominals are simply the anterior or the front part of your core. when we talk about the core, we are 3D human beings, and therefore the core is also 3D. So our core is in the front, the abdominal muscles. In the back, those multifidi I mentioned, these suckers. And then we have a top and a bottom. So we have, if I take one abdominal muscle out, we have a diaphragm at the top that makes our top of our core. And then we have pelvic floor muscles on the bottom that make the bottom of the pelvic floor. How I explain it to people when we're in the clinic is, in order for us to generate force, everyone needs to do 25% of the work. So we should have 25% of the work coming from the abdominal muscles when it comes to the core, 25% of the work coming from the back muscles, 25% coming from the diaphragm, 25% coming from the pelvic floor. A lot of times, if we don't have the ability to use the abdominal muscles correctly, what we then do is we ask the back to do like 60% of the work. And then because we're cyclists, we'll decide to go, oh, maybe we'll just use the hip flexors instead for another 30. And then everyone else will just come along for that 10%. So a lot of times it comes down to not only strengthening the abdominals, but also coordination of all those things together. So if we don't have the ability to use the abdominals appropriately, we have to ask the next best thing, which is these low back muscles. Low back muscles can only do so much work. They can't do everyone's job. And a lot of times what they'll do whenever a muscle has to do two people's job is they'll tighten up and then they'll get painful. A tight muscle isn't a strong muscle. It's a muscle that's hanging on for dear life. So that's a lot of times why you get off the bike and you're like, oh gosh, I feel really stiff through here. That's what's going on. That makes sense?
So thank you.
You bet. What else, guys?
To feed off of that question a little bit, I find that if I tilt my pelvic forward, it relieves pain in my back, provided I don't get slacky into it. And if I'm kind of curved back and sitting on my seat like it's a couch, things go forward.
You got it. Yep.
So
Oh, sorry. I didn't. I'm going to let you finish. Go for it.
where do we come into play in terms of our fit on the bike, and how much, you mentioned how we need to have it sounds like we need a bike that supports a neutral position. But where do we come into play in terms of like actively being like, okay, I have to tilt forward or back?
Yeah. So a lot of it comes down to what feels best on the bike for you. So you're right in that. So when you say like tipping forward and backwards, so you mean like if you tip, because depending on the person, it happens both ways. If you tip your hips like this, does it feel better, or like that? Second one. Yeah. Okay. So, and by the way, we call this tucky butt versus ducky butt. One of my patients came up with that, and it's really cute, and I think it is going to catch on a lot. But what happens with that is basically your position needs like to be in some sort of neutral, and for you, that tends to be a little bit of an anterior tilt. I'm going to answer that question by going around it one other way. One of the ways to figure out kind of where you need to be on the bike with that is in that bike position. Come on. Y'all can see me, right? Okay. So in that bike position, we should be in a position in that you can be able to get really light on your hands or even hover without feeling like you're going to immediately collapse into the bike. If you can't do that on the bike, what's happening is your bike position is not allowing you to use your core appropriately. What you should be able to do is be in a position where you can hover or just have really light touch on the bike in order to support the core. Now, how you come into that as a cyclist is typically by having at least a little bit of core work in your repertoire. It doesn't necessarily need to be something that's like, you know, half an hour of core work a day, but making sure you're having something that helps you generate force on the bike is really important. And when it comes to core work, I'm kind of specific about it. I like core work that requires you to do unilateral movement, so back and forth, just like you would on the bike, and something that isn't just having you crunch over and over again, because this is not the position we want on the bike. We want the ability of this core, the abdominals, to be able to hold you and lengthen in this position. So ways to strengthen the core in a way that's going to support that pelvic position you mentioned are things like suitcase carries. Do you know what suitcase carries are? I'll say, Lacey, you can probably show them. I'm tagging you in.
One kettlebell standing up straight.
You got it. Another good one is, maybe I'll just make you do more, Lacey. Stir the pots. That's another good one because, again, it puts you in a lengthened position. Farmer's carries, which are similar to suitcase carries, are also a great one. But anything that requires you to use your core without just crunching a bunch is really what you want to focus on in order to support yourself on the bike. Did I answer that question?
Yeah, thank you.
You bet. What else?
Do you have any suggestions on how to fit a saddle?
Ooh, that's a good question. That is a loaded question. The problem with saddles is like threefold, but saddles are tough. Saddles are very specific to each person. And give me 1 second, guys. I'm going to grab some. All right. So they measure saddles by the width back here. However, in the year of our Lord 2026, we are still not taking, for a lot of bike companies, taking into account the rest of the saddle and what's going on through here. So for people with trying to find the right saddle, they a lot of times will just measure your sits bones or kind of how wide your pelvis actually is and say, oh, okay, it's this wide, you need a small, medium, large saddle. But for a lot of us, we sit on this part of the saddle, but our soft tissue communicates with the rest of this too. And this is the part that's most important and also the part that is least standardized among saddles. So what really becomes important is this shaft, how thick or how wide this is, and then what the nose looks like as well too. And because they've not done a very good job standardizing any of this, and all they've done is measure this, it's hard to find a saddle that fits really well. The trade-off that they've made is a lot of them have like quote unquote warranties where you can like ride it for 30 days and then return it if you don't like it. At least Bontrager used to do that. Specialized used to do that. I'm hoping they still do that. But the biggest thing when it comes to a saddle is making sure that not only does it fit you here, so we talked about saddle rocking, but also if you feel like you're constantly tipping your pelvis like this to get yourself off those saddle or off those sit bones, a lot of times that means that that saddle and that shaft is too narrow for you and you need a thicker or wide, I keep saying thicker, wider shaft too. I tend to like the Specialized Mimic a lot. That's a saddle that seems to fit a lot of people well. I tend to not love cutouts. I know that was a big thing and I know some people think it leaves a lot of pressure through here. It tends to also create 2 pressure points on either side of these two. But for saddles, that was a really long way of me saying that it is really hard to fit a saddle. It's kind of like pillows too. Like everyone's got their pillow they like. It's hard to say, hey, this is your pelvis positioning. This is the saddle you need. So I will be a very rich woman when I figure out some sort of equation that actually makes that a little bit more easy. But the biggest thing with that is just unfortunately trying them out, seeing what you like, making sure you at least get a saddle where this width is appropriate, and then figuring out what you like best through here. What else you guys got?
I got a question. So you mentioned toe numbness or foot numbness. What about feet cramping up and toes cramping up? Is that the same issue or would that be different?
You said feet cramping up?
Yeah.
Yeah. It can be the same issue, especially that toe down positioning. What happens, again, if you have your toe down too much is putting pressure through those toes too. In order to like make them feel better, you'll oftentimes crunch in the shoe, and then that'll cause cramping at the bottom of the foot too. So a lot of times it can be, so look at saddle positioning first, saddle height first, and see if that can help.
I think it's actually my toes that are cramping, if that makes a difference.
Your toes cramping?
Yeah.
I'm sorry, repeat that one again.
It's not my foot cramping, I think it's my toes.
Yeah. So your toe muscles, your muscles that control your toe, they come right through here on your foot. So when your toes cramp like that, it's the muscles start here, but they end at the toes themselves. Yeah. Which is really uncomfortable. What else can I answer for you guys? We got some time if you're up for it, so shoot away.